Good morning, everyone. First, I'd like to start by I'll introduce myself. I'm Joe Orsini from the New York State's Newborn Screening Program, and Elisa gave a little bit of the story about how New York ended up being the first state to start screening for ALD. So as a result, it doesn't take long before you're considered the expert, even when you're not the expert. And I've tried hard to live up to that over the years. But I wanted to thank Elisa because she started this meeting, organizing it from fairly soon after we got started. And that was to help us learn from other folks in the ALD community, as well as as other states came on, to be able to share our experiences collectively. So this started off kind of growing as the states started adding more screening. And in the early years, we were really trying to figure out what we're doing, what's it mean to detect some babies that I've talked about in the past where we're not really sure if they'll develop ALD or not. Then there's ones that we're pretty certain have a very high probability or chance of developing disease. And through the years, we've exchanged data, kind of learned from each other, and we started seeing patterns of data where we're looking at concentrations that look like they're on the borderline of our cutoffs. Those babies weren't really sure what we should be doing with those as far as should we detect them or not. We were finding variants that had never been seen before through newborn screening. So that's been kind of a topic of the meeting for a few years. But more recently, as more and more states came on, that everybody's kind of aware of that. So yesterday's meeting was a little bit of a focus on some of that and more of a focus on other newborn screening related topics, such as when do we add diseases to the newborn screening panel? How is that done? It used to be done at a federal level. That group has been dissolved under the current administration. And as a result, we're kind of left in the newborn screening world wondering, well, should we add something? Shouldn't we add something? Where's our guidance? And there's a group that's the American Academy or College of Genetics and Medicine, ACMG, that's working on putting together a group that'll fill that void if it's needed. So that was talked about yesterday. And then there was the Surge to Save Newborns, I think Elisa added or alluded to earlier, which is to help all states throughout the country be able to do screening for the recommended uniform screening panel. So that was also a big part of the discussions yesterday, as well as a bill that's been was originally introduced, I believe, in 2017, and it was the Newborn Screening Saves Lives Act. And that went for a few years, and before it didn't it actually went, I think, 5 years, and then didn't get renewed because people in the Congress were concerned with privacy issues with storing dry blood spots. So that's been hung up in that way for a while, and people were talking about the strategies to get that bill passed again. So that was probably more of the meeting than what you're going to see in my slides, and I just wanted to go over a little bit about what we talked about in our 1 hour of the roundtable associated with screening for ALD. So my disclaimer is it's a summary of discussions from the roundtable meeting, so that my state didn't need to approve the slides. So 10 years ago, Joseph Boccini approved screening for ALD. So we started in the very end of 2013. And so 2 years later, a lot of the data we had was actually used to contribute to getting this screening onto the recommended uniform screening panel. Yesterday, we had a smaller outing of individual states. These are the states I knew of that were on the talk or the call yesterday or contributed some data. There may have been others. I apologize if you're on the line and you see this and your state's not here, but I never could see who was on the call. But for the most part, we were just going over. We decided everybody's level setted with what's a diagnosis. Sorry, this mic's acting up a bit. What's a diagnosis? And everybody agrees it's a variant in ABCD1 gene with elevations in the very long chain fatty acids. So the states provided really basic updates. We talk a little bit about the ALD variant database. And some of this other stuff is just normal screening talk where we talk about lab methods, but we didn't have a lot of discussions on that. The ALD incidence project, Michelle's going to talk a little bit more about, Michelle Kajana, after I get done here. She's not on the agenda, but she'll go over what she's looking for from the states, and we're trying to put together just an overall paper that states what are the numbers, what are we up to now? Like in New York, we're up to 2 million babies, but across the country, how many million have we screened? How many girls have been detected? How many boys have been detected or diagnosed with at least a genetic / biochemical diagnosis? So these are that's some of the data that we're trying to collect for the paper, just to give an overall overview of what ALD screening has been done in the states. One of the things for states that may not have contributed data, I'm going to put in a plug here, and Michelle probably will as well, to please send in your data. I think we're going to start looking at a deadline of saying we're going to just take what we get, and that'll be, we'll take X number of states out of the 50 and call it the end of the project, because it's not easy to get this data, and we want to move on with the project. So that's all I have for update. It looks like, I think some of the state updates I was going to provide are very minimal, so I think you'll just see a little bit more from Michelle about that. Anyway, thank you very much. Move on.